I'm going to talk about my favorite subject, that is cardiovascular simulation. My name is Michael Broomé. I'm a medical doctor right now working in the ECMO unit at Karolinska, the Solna site, with helping people with heart-lung machines that are really very sick. I've been working 10 years as an anesthetist with cardiac surgical patients as well. And since a few weeks back, I am also employed 25% of my time here at KTH. This is really my hobby project that is now becoming research. I've been programming a model of the cardiovascular system for the last 10 or 15 years, and it's really an electrical analogy of the circulation. It's based on an article written by a researcher in the US called Ying Sun, and I have further developed this model. And as you can see, there are electrical components like resistors, solenoids, and capacitors. And the light yellow part is the intrathoracic space. The dark yellow is the pericardial space. And then we have the systemic circulation there, and the pulmonary circulation within the thoracic compartment. That's the left ventricle, aortic valve, ascending aorta, descending aorta, and then further on to large arteries, large veins emptying into the right atrium, over to the right ventricle, and then we have the pulmonary artery, and finally the pulmonary veins emptying into the left atrium. This is just to give you some brief information about the complexity of the model. And from this electrical circuit, you can generate differential equations looking like this. It looks a little ugly, but these equations are solved every millisecond by a normal computer. And then when you use the model, you get pressure, volume, and flow at every point of the circuit model. And you can do real-time simulation of systolic heart failure, diastolic heart failure, all kinds of valvular failures, shunts, pericardial effusion and constriction, intrathoracic pressure variations with ventilator treatment, septal interaction between the right and left ventricle, arrhythmias, aortic coarctation, and other vascular disorders like arteriosclerosis. And you can also simulate, for educational purposes, cardiac catheterization and extracorporeal circulation, like what I'm working with in my clinical part of my job. And here we have screenshots from the simulator. I think I'll very briefly start the simulator during the last minute, after first mentioning what are our goals with the research. So short-term goals are to simulate oxygen transport during ECMO, and also treatment of pulmonary hypertension with extracorporeal circulation. And together with Johan Hoffman and Jeanette, three-dimensional finite element models of the left ventricle with the cardiac torsion, vortex formation, and energy transfer studies. On the long term, we hope to build a bigger three-dimensional model of the entire circulation, or at least the entire heart. And these are some of the potential partners in this research, and that has recently started. Just 1 minute to start the simulator. If you listen carefully, you can listen to the heart sounds as well. Here we have pressure volume loops of the left ventricle, right ventricle, left atrium and right atrium. And then for example, we can simulate aortic valvular problems like aortic stenosis. So I reduce the area of the aortic valve. You see that the pressure inside the left ventricle increase. And then we can also, on the same time, simulate an aortic regurgitation. And data can be presented in pressures, flows, and volumes as well. This is just an example, and I think I'll have to finish my presentation there. Thank you.